Welcome to my world. Another day, another time, another period to experience knowledge appreciation. Knowledge is power, health is wealth. I shall today take you on the journey of each experience in the area of cancer. The topic shall dwell more on the cervical cancer. I titled this video, Why Cervical Cancer? That is always the question we ask ourselves when we come down with problems or when we are very victorious in certain area of life. Why me? That is the question some will ask when they become very successful in certain things they do. And also we ask ourselves why when predicaments befall us. Why is as if a problem is spontaneous, but in actual reality, no problem is spontaneous. It has the warning signals which we fail to always observe. As far as health problem is concerned, the warning signals are risk factors always listed. And the awareness of these risk factors is very necessary in avoiding the problems. For example, age is a very common risk factor of chronic diseases. But how do you tackle aging problem? It's only by slowing the process of aging, which I have exposed in my previous videos. Today, the effort is also towards exposing the risk factor in cancer, cervical cancer. I will do more in other fields. So let us sit down, but if we like what we are seeing, if we like the production, let us click the like button, subscribe, and the production will continue to be top notch. Why cervical cancer? That's the outline. Objective, introduction, sign and symptoms, risk factors, diagnosis, prevention and control, and finally conclusion. The objective, to expose certain factors that make some people susceptible to cervical cancer, while some demographic and groups have rare or no experience of it at all. Introduction, cervical cancer is officially called squamous cell carcinoma, and it's 90% of the cancer, cervical cancer that is seen, and it is the cancer that starts in the cells of the ectocervix. The adenocarcinoma starts in the glandular cells of the ectocervix. The cervix marks the beginning of the uterus where the fetus develops. It connects the uterus to the vagina, the birth canal. The squamous cell carcinoma or adenocarcinoma of the cervix develop gradually over time and are thereby graded into 3 or 4 phases, as we see here. The phase 1, you can see that the cancer has not yet started bleeding. The phase 2, the bleeding and it is spread. And the phase 3, it looks like it is now metastasizing. And when you look at the uterus, you will see that the tip was the phase 1, it was the infection or the spread of the cancer was at the tip, and the last part is spreading all over. The causes is Human Papillomavirus, and it's about 95% of cases. The herpes simplex is just incremented at times. Signs and symptoms, blood spots or light bleeding between the following period. The menstrual bleeding, during sexual intercourse, you still find pain and bleeding, increased vaginal discharge, pain during sex, bleeding even after menopause are all signs. Risk factor, the risk factor starts with from age 25. Having sex, the peak age of the problem is 55 years. Early age of first clitoris is also being associated intercourse shortly after birth or during puberty, because the metaplasia has influence on cell growth, as that period is still allowing so many growth. The virus itself will grow along with it. Early circumcision is a protective effect of facilitating good hygiene of the penile gland. Multiple sex partner in both sexes. There is high incidence of the malignancy in prostitutes and the people who have given birth to so many. Smoking, overweight, obese, and even oral contraceptives and HIV infection are part of the risk factors. Prevalence 2020. Cervical cancer is the fourth most common cancer in women, and the 10 countries with global incidence are in Africa. Diagnosis. After seeing the clinical features for presumptive diagnosis, the following tests are done. You want to rule out anemia because the patient will be bleeding normally and the infection would have set in. So these are part of the test the doctor would usually request for. The E&U to look at the renal function, whether it has extended to that level. The chest X-ray is also very important to rule out metastasis of the lung. The biopsy and all these others are also important samples collected. The stage 1 of the problem is strictly confined to the cervix. Stage 2 of that problem 2 is beyond the cervix, and stage 3 extend to the pelvic floor, while stage the survival rate is within 5 years. Stage 1 will give 85% of 5 years, stage 2 50, stage 3 25, while stage 4 5%. The prevention and control. Vaccination of girls aged between 9 and 14 is the usual practice so that they will not develop this cancer in future, and it's available as Gardasil and Savasbil. 2. Reduce the risk level. This risk level is also important. The screening test is also to test the pelvis for the pre-stage, where you can start all the chemotherapy and radiotherapy. Conclusion. The rate of scourge of cervical cancer is on the downward trend with more knowledge on the risk factor. The availability of vaccines against human papillomavirus has tremendously reduced the incidence of cervical cancers in developed countries. The developing countries could be assisted with donation of these vaccines by WHO or any international agency in order to reduce the incidence and death rate. Please, you can look for more of health videos on my channel. I have so many of them, and it will be